So this exercise here is the seated knee extension machine. For a safe setup, you sit comfortably in the machine with your back against the pad and your knees aligned with the machine's pivot point. You should try and adjust the pad for comfortability. The lower pad should rest just above your ankles, ensuring it is positioned so that your legs are fully bent at a 90-degree angle at the start of the movement. You should place your feet flat against the foot pad, ensuring your toes are pointing forward. Your legs should be in a relaxed and natural position without any strain, as this excessive strain can cause injury, leaving an athlete or individuals out for long periods of time. The exercise technique begins with sitting upright with your knees bent at a 90-degree angle, making sure your hips and lower back are in contact with the backrest for support and not leaning forward, and using excessive momentum to guide you, as shown in the video. And your feet should be placed flat against the foot pad, and your hands can rest at the side handles or on the machine frame, which can give you extra stability when controlling the movements. The movement should be initiated by pressing the foot pad with your feet, straightening your knees as you lift the weight. The movement should come from your quadriceps, so focus on contracting them as you extend your leg. This should be continue until your knees are extended and are almost straight, but try and avoid locking them out completely at the top, as this can cause injury and strain. When lowering, you should slowly lower the weight back to the starting position by allowing your knees to bend, resisting the pull of the machine, and the descent should be controlled so that the quadriceps can remain engaged and contracted throughout the movement. This should then return to a 90-degree bend at your knees and rest for the repetition. 3 key coaching points is focus on full control and try and ensure that you're controlling both the extension and the return phase, slowly lowering that weight back down. Try not to let the machine pull your legs back too quickly, as this can cause any unnecessary strain. Try and avoid also locking the knees when you're at full extension, as this can keep the tension on the quadriceps and reduce stress on the knee joint, and also maintain a natural spine throughout the movement. The main muscles used in this exercise is the quadriceps. The quadriceps consist of 4 muscles: the rectus femoris, the vastus lateralis, vastus medialis, and the vastus intermedius. The rectus femoris inserts at the patella and tibial tuberosity, and its origin is the anterior inferior iliac spine, also known as the AIIS, of the pelvis and the superior part of the acetabulum. Vastus lateralis inserts at the patella and tibial tuberosity, and its origin is the greater trochanter of the femur and lateral lip of the linea aspera. Vastus medialis inserts at the patella and tibial tuberosity also, and its origin is the medial lip of the linea aspera and intertrochanteric line of the femur. Vastus intermedius inserts at the patella and tibial tuberosity as well, and its origin is the anterior and lateral surfaces of the femoral shaft.